Hello and welcome to another edition of Medical Today. I'm Gerard Ratnam, and on today's edition we're going to be taking a look at a few things. We'll be taking a look at your eyes. We'll be having an ophthalmologist talking and a corneal surgeon talking about lenses. That's going to be happening soon. We'll also be talking to Dr. Chua Kyong Tiong, who's a consultant physician and respiratory physician at Ramsay, Sime, Darby Healthcare. He's going to be talking about pneumonia. But to begin the show today, we have Azlina Al-Jeffrey, who is the head of plant for Bio-Collagen Technologies at Berhad, to talk about dressing and healing of wounds. Now, essentially, a dressing is a sterile pad of compress applied to a wound, and this is to promote healing. So we're going to find out more about this thing called the Bio-Collagen skin. And to do that, like I said before, we have Azlina Al-Jeffrey. Azlina, thank you very much for joining us. So much information we want to get from you, and I certainly do hope we have the time. So just give me a background information of your company, the Bio-Collagen Technologies in Berhad.
Bio-Collagen Technologies actually has been around for more than 6 years. And Pharmaniaga bought over the business in May 2016. Our factory actually, we manufacture collagen-based, bovine collagen-based dressing. It's used for basically for burns and for non-infected wounds actually.
So it's just one type of dressing that you do?
Yes, we do one type of dressings. We have two types actually. One is wet skin, Bio-Collagen wet skin, and the other one is Bio-Collagen dry skin, dry sheets. Actually, both of the collagen is actually the same. It's just the representation is different. One is wet, and the other one is dry.
Right. What are the main ingredients of Bio-Collagen skin, and where are these ingredients being sourced from? That's very important because, you know, in a halal market like ours, everyone always wants to know where ingredients are being sourced from. And maybe you could, if you can, walk us through the processes which are involved, and how long does it take to manufacture these products?
We actually collect our materials, our raw materials from our local vendor. So our local vendor. So basically, before we actually buy from the vendor, we will actually make sure that the products are halal-based materials. So from the local vendor, we will do our own collections. We will do the collection three times a week, basically. And what we do is that it is collected from the bovine digestive system. Right. It's called the cecum. So basically, what we do is that from the cecum, we will extract the sheets of the cecum, where most of the collagen is obtained from.
Yep.
And so we will do a chemical and enzyme process onto the
right.
the
So
collagen.
what you're telling us is that the collagen is a derivative of the cecum, which is a something that's found the gastrointestinal tract
of the bovine. Yes, correct.
Yeah. So I mean, the process seems like it's a very long process. Now, when it comes to manufacturing, you know, what is it like? What is the process like within the factory itself?
So what we do is that when we collect the bovine collagen, the bovine cecum, which is we call it the serosa layer, or
it's called the serosa layer. Okay.
Yeah, where we actually take the our raw material from the serosa layer or from the tendon. Once we collect it from our local vendor, what we do is that we will do a chemical and enzyme process onto that materials, and usually a production process will take about 35 to 45 days. 35 to 45 days, because the whole manufacturing process, because through chemical process we have to store it for a few hours into it is a controlled environment.
So it's quite a long process.
Yes, it's quite a long process.
Now when we talk about the product itself, where, how and who can use Bio-Collagen or the skin products?
Actually, these products actually use currently what our customers are namely the government hospitals and the private hospitals, and we actually only doctors and medical professionals is using these products, because we want to make sure that the wound that they are treating is totally clean and non-infected.
Right.
So because collagen is actually a protein-based material, so it's actually a food for the bacteria. So we want the doctors to make sure that the wound that they are treating is actually non-infected before it is used onto the wound.
Now, when you talk about wounds, from what I understand and from the reading I've done, the Bio-Collagen skin is usually used for burn wounds, right? Now, how long does it usually take for a burn wound to heal using this product or Bio-Collagen?
Because our products are collagen based, and the collagen is actually the most abundant cells in the body actually. So basically from the testimonials that we have from our doctors, it takes about 7 to 10 days for the wound to heal. And one thing that the doctor really noticed about what our products, the benefits of our products, is that very minimal scarring. So for patients who, for burn victims, especially around the facial areas, so when they use the collagen, they found that very minimal scarring, and then the doctors find it's very easy to use, because once they use it, they just leave it on to the patients, and then the patient do not need daily dressing actually for the patients.
Very quickly, let's move on to the accreditation that the company has. It's received quite a few accreditations from various bodies. Let's give us some information about the accreditation.
Basically, Bio-Collagen products are actually medical device, is classified as medical device. So once you are
classified as a medical device, so not all of us can just go and buy it. It is for medical professionals.
Yeah, it's medical professionals. So it is classified under the classification of medical device. You must have a few accreditations like ISO 9001 and ISO 13485, which Bio-Collagen has currently. And we also, the company is also a BioNexus company. So we have, and we are also embarking into the, we are also going into accreditation, CE marking, which is an international accreditation, so that we can actually launch the product internationally.
Now, would you say that this is a breakthrough technology for Malaysia?
Bio-Collagen is actually the first company in Malaysia that produces these products. We are the only one that's produced.
Right, so it's been in the market for 6 years. Now, if it's been in the market for 6 years, the other question that comes to the fore is, why don't many hospitals use it?
Because during Pharmaniaga, when Pharmaniaga we bought over the company in May 2016. So we started to aggressively market the product in the market. So we have basically, if you just see that we are only about 2 years after Pharmaniaga bought over in May 2016. So we have a lot of customers now starting to buy the product. So the sales are picking up.
So if you have a lot of customers starting to buy products, let's say homes, you know, are taking care of older people or senior citizens. They use it for bed sores. Do the staff need to be trained to
yes,
use
the
it?
staff need to be trained.
Right.
Because as I said earlier, we just want to make sure that the wound are non-infected, because we want it to be clean and we need to have the wound to be fully debride. That means you need to take away all of the dead skins from the wound, and then we need to have proper application, because one of the products that Bio-Collagen has, which is the wet sheet, we actually put into a preservative medium, which is the isopropyl alcohol. So if you don't thoroughly rinse that, when you put it onto the wound, it's quite painful for the patient.
You're asking for trouble.
Yeah, asking for trouble.
Well, it's used for chemicals, chemical damage. Used for what do you call it? Skin graft.
Skin grafts. Yeah.
What else is it used for?
We can actually use the product.
So when you say it's used for chemical
food.
damage, it simply means if you get scarred by chemicals.
Yes.
Yeah.
Yes.
Yeah.
If you get scarred by chemicals, you get scarred by hot water, and then if you get any Bio-Collagen products, we can actually use for any types of wound as long as it is non-infected. It works wonders onto the.
As long as the wound is not infected,
yes,
you can use the products.
Yes.
If it's infected, what happens then?
If the products, if the wound is infected, we would recommend the doctors to actually clear off the wound first. Let's say, for example, we have a patient who is diabetic. We have one patient who is diabetic patients.
And
so,
of course, as a diabetic patient, you have to deal with infections.
Yeah, infections. Yeah, usually when a diabetic patient, when they have wound, when they come to the hospitals, their wound is already infected.
Right.
So once the doctor has cleared the infection, so the first thing the patient will ask the doctor, okay, when will my wound close? That will be the only question, because okay, now I have no infection, so when are you going to cover? When is the new skin coming out from for the wound? So we have one patient which the doctor uses onto the patient, and the wound closes within 2 weeks.
Fantastic.
It became small, and now usually the patient actually initially bought it because we have a few ranges from 5x5, which is the smallest one, until to the 1530 cm, which is the largest. So the patient used the 10x10, but now the patient is using 5x5.
Right.
So and
that
the
just
wound,
goes to show how quick it works.
Yeah,
and
within 10 to 14 days.
Fantastic. So we just talked a little bit about dressing, or the new age of dressing. We looked at a company called the Bio-Collagen from the Bio-Collagen Technologists Gerard, which is in Sri Kembangan.
Yeah.
Thank you very much. We'd like to thank Azlina Al-Jeffrey for joining us on the show. But we also talked a little bit about infections. In our next segment, when we come back, we're also going to be dealing with infections, but this time with the eye. All that and more when we come back, right here on Medical Today. Stay with us. Welcome back to Medical Today. I'm Gerard Ratnam, and of course on the show we just touched on a thing called Bio-Collagen Technologists in Berhad, which is a company that comes up with alternative treatment for burns. Very interesting topic indeed. From there, let's move on to contact lens complications. Now, a lot of us want to use contact lenses. We want to look like Bollywood stars these days with colored contact lenses. What's all that mean? Joining me in the studio is Dr. Vanita Ratnalingam, a consultant ophthalmologist and a corneal surgeon from Ramsay, Sime, Darby Healthcare. Doctor, thank you very much for taking time off to be with us. So I guess today what we're going to talk about would be contact lenses.
That's right.
Why do you want to talk about contact lenses, you know, because you do corneal surgery?
So I think it's very popular these days. As you said, everyone wants to
get
look
the hazel ones, yeah,
like a Bollywood star. And I wouldn't say contact lenses are not dangerous, but there are risks involved with contact lenses, and we see a lot of that as corneal surgeons. You know, especially when there is very little contact lens care. and the complications can be devastating. So I think it's something that everyone should be aware of. It's not just, oh, let's pop a contact lens in and look pretty. There are complications. So,
but having said that, you know, contact lenses are so readily available for anyone. Do you think that's a bit of a problem?
That's right. So there are many types of contact lenses. This includes powered and non-powered contact lenses. So in Malaysia, powered contact lenses are registered as a medical device. However, and because of that, its sales are fairly well regulated. However, non-powered contact lenses are not required to be registered as a medical device and therefore can be sold freely by all kinds of dealers.
And therein lies the problem.
Yeah, because, you know, non-powered contact lenses, are they free of the complications of powered contact lenses? And the answer is no. They have the same possible risks and complications.
Right. So now when you talk about complications, what kind of complications are we looking at? And basically these complications come from the non-powered lenses in it. That's
not necessarily true. Complications can come from both powered and non-powered contact lenses. So I think it's just the use of contact lenses. Even if you follow all the rules and regulations, you know, there is always a risk of complications. However, if you are careful, obviously the risk is lower than, you know, if you were to sleep with your contact lenses and things like that.
So let's talk about the indication of contact lens wear.
So everyone knows that contact lenses are used for to improve vision, and there are various...
To look good also?
That's one of them. So there are different types of contact lenses. There are soft contact lenses, which are more commonly available and preferred as well, and the reason being it's thinner, it's got a high water content, and so it's more comfortable to the eye. Patients actually can feel immediately comfortable with that. The downside of soft contact lenses is that it's easy for particles to actually adhere to the contact lens proteins and lipids and can cause discomfort, inflammation to the eye as well. There's also rigid contact lenses, which are actually, provide pretty good vision, crisp, clear vision actually compared to soft contact lenses, and they are very good for patients with higher powers, higher astigmatism, but it takes time to adapt to these lenses, and therefore not so many patients, people prefer them. Having said that, the risk of complications from soft contact lenses are higher compared to, say, rigid contact lenses, and of course you've got extended wear contact lenses and, you know, daily disposable contact lenses, basically different wear patterns and different replacement schedules. So the daily disposables tend to have a less risk of complications compared to, say, the monthly disposables.
Just to digress a little, let's look at technology of contact lenses from the time it started to now. You know, how far has the technology moved?
So in the past, contact lenses used to be hard contact lenses made of plastic. The rigid ones we get now are actually not the same as the hard contact lenses that we used to have. The contact lenses now actually allow oxygen to permeate through the contact lenses. The soft contact lenses that we have actually are made of silicone or silicone hydrogel, or sometimes you get a hybrid, a combination of both. So it's not just more comfortable, but it allows, you know, oxygen to, you know, basically permeate into the cornea to, you know, reduce the risk of, you know, complications such as inadequate oxygenation.
Why is it that when you meet people, you know, you have so many friends, you're sitting with them and say, my lenses are killing me, I need to take them off, you know, like, you know, I was even suggested, my optometrist suggested that I wear lenses, and I said, nail me to a cross, you know, because it looks so frightening. What's happening there?
So, yes, it can cause discomfort, but most of the time that's because of the possible complications. One is dry eyes. Contact lenses are a foreign body that's sitting on your eye, and it actually affects the flow of tears across the eye. So it's very common among contact lens wearers to get dry eyes. The other problem is that, as I mentioned, it's a foreign body where particles and deposits like proteins and biomaterials actually adhere to the contact lens, which can cause a lot of irritation, even clouding of vision. The cornea is a living structure, and it actually gets oxygen from the tears. Now, if you've got if the flow of your tears across the eye is affected, then oxygen cannot diffuse from the tears into your cornea, and you actually get a condition called hypoxia, where there's inadequate oxygenation of the cornea. And this can lead to abnormal vessels growing into the cornea, which can cause it to become, cause scarring, as well as a lot of inflammation in the cornea. The cornea is supposed to be clear, so abnormal vessels, it's not a good thing, believe me. But so these things definitely cause pain. Now, wearing the contact lens longer than you should actually causes the contact lenses to dry out. As I mentioned, the soft contact lenses have got a very high water content, but it's easy for that to dry out, and when it does, it can cause discomfort as well. So if you're wearing it longer than you should, or even if you are in a very dry environment, or even if you're using the hair dryer, really, it can cause your contact lenses to dry out, and all this can cause discomfort. But by far, the most dreaded complication would probably be corneal infections. This can be quite nasty, and it can lead to blindness.
Right. Before we move into corneal infections, let's talk about the suitability. Like, every individual has got a different makeup, when it comes to your eye structure, so on and so forth. So I'm guessing here that if you're going to wear, if you're going to be prescribed, I think people should be prescribed lenses. You shouldn't just go, it's like self-medicating, I think. What are your thoughts on this?
Yes. Okay, you mentioned everyone has a different makeup, so is everyone suitable for contact lenses? The answer is no. You really need a healthy ocular surface in order to start wearing contact lenses. There will be changes that occur in the eye when you're wearing contact lenses. That's going to happen. So obviously, if you have a poor ocular surface or an unhealthy eye surface before that, then you're definitely going to run into problems. Okay,
I need to stop you here to find out. Now, when we talk about an ocular surface, I think that's a take-home for us already. So what are the essentials of an ocular surface? What do we need to know about having a decent ocular surface?
Okay, so normally your eyes should be healthy, on its own, but one of the problems that we have is dry eyes. People with dry eyes are poor candidates for wearing contact lenses. One of the common causes of dry eyes is really the amount of screen time that we use. Dry eyes used to be more common among the elderly, but now it's becoming increasing.
5-year-olds have dry eyes.
7 to 12-year-olds have dry eyes. It's a lot of it has to do with how much time you spend on the iPad, on the computer, on the TV. Every time you are focusing on something, and even reading for that matter, you actually blink a lot less than you normally would, and this does dry out the eyes. So dry eyes is becoming a common problem today, but besides that, people with really bad allergies are poor candidates for for contact lens wear. Patients who have got frequent eye infections, or even those who work in dusty or dirty environments, are generally not good candidates for contact lens wear.
Now, coming back to corneal infection, which is the most feared complication, what do we need to know about this?
Okay, so a corneal infection can occur among contact lens wearers, and the reason is because they tend to have an unhealthy ocular surface. As you know, there's less oxygen going in, the eyes tend to be dry, contact lens wearers tend to develop allergies as well. And because the surface of the eye is unhealthy, the surface tends to break down quite easily, and so it's easier for organisms to penetrate into the cornea. Some of the habits of contact lens wearers actually predispose them to corneal infections.
So when you take it out, and if it's not clean, you put it back on.
So it's really important that you want to wash your hands before you put on contact lenses, handle your lenses. The other thing is, always use your contact lens solution to clean the lenses. Never use tap water, and definitely not saliva. You'll be surprised. Yes. So the problem with tap water is that it contains a type of bacteria called Pseudomonas aeruginosa, and that's the most common bacteria.
I'm guessing here, if you can't pronounce it, it's definitely dangerous.
That's that too. But what happens is it's found in tap water. So if you're putting a contact lens in over the sink and it falls down into the sink, and the sink is wet, and you put it back into your eye, you've transferred some organism into your eye already. And because the eye is unhealthy, it's easy for that organism to cause an infection.
Jeez.
Another organism that's found in swimming pools is a type of protozoa. I won't mention the names, but
please do. I mean,
it's called Acanthamoeba, and it's very resistant even to the chlorine in swimming pools. So swimming with your contact lenses on is a big no-no.
Right.
Okay, because once the organism adheres to your contact lens, you could get an infection, say even a month after.
Let's keep this as a cliffhanger. We'll take a short break. Okay. When we come back, we'll give you more bad news about wearing lenses right here on Medical Today BNC. We are currently joined by Dr. Vanitha Ratnalingam. She's a consultant ophthalmologist and a corneal surgeon from Ramsay, Sime, Darby Healthcare. We'll be back just after the break. Thank you very much for staying with us right here on Medical Today BNC, or the Bernama News channel. We're currently talking to Dr. Vanitha Ratnalingam, a consultant ophthalmologist and corneal surgeon from Ramsay, Sime, Darby Healthcare. Now, you're talking about infections, and the last we spoke, you were talking about swimming with your lenses on. That's a big no-no because you're opening yourself to more infection, right? Okay, from there, what else do we need to know about infections?
So besides swimming, cleaning the contact lenses with proper solution, it's also important to ensure that the contact lens casing is clean. Organisms tend to grow in that casing, and when you transfer your contact lenses from the casing to the eye, that's another way of transferring an organism into the eye.
And your fingers going in and out, is not going to help, in it.
Assuming you've washed.
Assuming you've washed it. Yeah.
Yes. Sharing contact lenses, definitely don't do that. You'll be surprised. We do see people who share contact lenses, especially
group therapy is no good
contact
with
lenses. Yep. So these are some of the common causes that we would see of patients coming in with corneal infections, treatment has to be aggressive for corneal ulcers because the earlier you catch it, the easier it is to treat.
Okay. When people start to have complications, the last person they'll come and see is someone like you. They'll walk into a pharmacy and say, my eyes are itchy, what do I do?
Yes.
So the pharmacists will go and look at this whole range of products and take one out. This is good. These are tears, artificial tears. And that in itself frightens me.
Well, I would be less frightened if the pharmacist took out the artificial tears. Unfortunately, what happens, a lot of these patients have got red eyes, and when their eyes are red, they often go to the pharmacy and they get topical antibiotics with steroid combination.
Right.
And so they actually end up putting steroids in their eyes, and it helps with the redness, but it actually worsens the infection.
But it comes with a caveat that use it for 3 days.
1 day, 24 hours of steroids is all you need for the patient to go blind in the eye.
There you go. This is the information we're looking for. So do not go to a pharmacy and get any steroid-based eye drops if your eyes are red. That's what you're telling us.
Exactly. Yeah. So if the eye is red, you really want to take off the contact lens, stop contact lens wear, and see your ophthalmologist immediately. What we will do for these patients is we will actually scrape off the surface of the infection and try to culture it to find out what organism is causing the infection. Once we know what organism it is, then we can tailor our treatment accordingly. But as soon as we've done that, we will start the patient on intensive topical antibiotics. I will tell my patients to use the drops every hour, even throughout the night. So you really want to set your alarm and wake up every hour to put the drops, because what you want to do is you want to hit hard and you want to hit fast. Once you've got a high concentration in the cornea, basically that would be your best chance of eradicating the organism. If everything goes well, the ulcer will heal, but it will leave a scar.
Yeah, but there's a little bit of a problem with what you're saying also. See, you said once you ascertain these problems, go see your ophthalmologist straight away. Not most of us don't have an ophthalmologist. We go to our primary care providers, which is our general physicians who look at our eyes and say, I'll give you some drops for that.
Okay. I think if you've got a good general care provider, they'd be able to assess the cornea, and once they see that there is a problem on the cornea, they would immediately refer you to an ophthalmologist, because a small white dot can become a large white dot by the following day.
Right. So saying you have complications now, let's talk about the treatment regime. You're saying that, you know, if you're put on antibiotics, you need to do it to the clock, okay?
Yes.
Yeah, set your alarm and do it. You need to go hard and fast, hit it as soon as you can, and be very disciplined about it.
That's right.
What else do we need to know about this?
Well, as I said, if everything goes well and it heals, it will just leave you with a scar. The problem is if the scar's in the center of the cornea.
That's a fingers crossed scenario, if everything goes well.
If the scar's in the center of the cornea, it will affect your vision. Now, if the antibiotics are not effective in eradicating the organism, then the next step will be surgical treatment. And so what we do is a corneal transplant, where we sort of remove the diseased area of the cornea and we transplant it with healthy corneal tissue that's been donated, donor tissue.
Right.
And yeah, that would probably be the only way, because if you leave it, or leaving it untreated will result in a corneal perforation. The cornea perforates, and or worse still, if the infection actually spreads to the back of the eye, and then you could lose your eye.
Right. I don't mean to be the Grim Reaper here, but what's the worst you've seen as a corneal surgeon?
I have seen patients who have actually lost their eyes. So even with a very bad infection, even doing a transplant doesn't guarantee you that the patient doesn't get a reinfection. Of course, if the infection's already gone to the back of the eye, then sometimes you have no choice but to remove the entire eyeball, or well, at least the contents of the eyeball, in order to save the infection from going further back into the brain and causing an infection.
Lovely dinner conversation. Well, coming back to things we need to know as lay people. Now, if I'm going to get lenses, what would you suggest?
Always, especially if it's your first time getting lenses, get your lenses from a registered eye care provider. One of the reasons being they'll be able to assess your eye and to make sure that this eye surface is healthy for contact lenses.
So you're talking about a trained optometrist?
A trained optometrist will be fine, will be good. And the other thing that the optometrist can help you with is to measure the cornea, measure the steepness of your cornea, because it's not one size fits all. Everyone has a different shape of cornea, and they'll be able to tell you what the best fit is. A lot of the complications that I've mentioned, like not having enough oxygen, dryness, a lot of it has to do with poorly fitting contact lenses. Besides overwear, there's also poorly fitting contact lenses. So you want to make sure that your contact lens actually fits you well. So the optometrist will help you to do that, as well as to teach you how to take care of your lenses, you know, when you should change them, how long you should wear them. They all differ depending on what type of lens you have. So rather than going to the night market, where sometimes the contact lenses are not even sterile, we do have more and more patients coming in who, you know, buy contact lenses from night markets, who buy contact lenses online. Worse still, in some countries, I haven't seen it here yet, you can buy contact lenses from a vending machine.
Right.
Yes, so yeah, these are things you want to avoid.
Right, so always get your lenses from someone who's trained, that's what you're saying. Now, that's fairly good advice, simple advice, and also, like you said before, the makeup of your eye, the optometrist needs to tell you that and what fits you best.
Yes.
Now, one other thing I want to talk about before we end this conversation on complications or with contact lenses is what we're talking about just now, getting just artificial tears or getting eye drops. A lot of us are on eye drops today because, you know, we get scratchy eyes. Now, I work in a studio, you know, there's a light all over. I just go to the pharmacy and the pharmacist, you know, once again open his whole range of these are the products, I'll pick one for you. And not that I know anything about this, but no, how do we pick these products, and why are we all moving into having artificial tears these days? Yeah, like you said before, I know you said, you know, we've got too much screen time, so on and so forth. But to some extent, this has become very frightening, you know.
Yes, that's true. It's definitely more common nowadays.
Does air conditioning?
Yes, it does. So air conditioning is something that, you know, will obviously dry out your eyes. But the other thing is also just living in KL, the dusty environment tends to aggravate dry eyes as well. It's something that it's difficult to run away from. Now, the thing about dry eyes is it's also advisable to get it checked, because there are two types of dry eyes. One is when your eye doesn't produce enough tears, and really the only thing you can do about that is to supplement it with artificial tears. The other type of dry eyes is when your eye is producing tears but it's not stable, and one of the causes of that is actually the oil glands in our eyelids is not producing enough lipids or oil to sort of protect your tear film. So your tear film actually has an oily layer over it, and that helps to prevent tears from evaporating. So your ophthalmologist will be able to assess your oil glands and see if that needs to be treated. Then that is something that can be treated.
Right. And on that note, we'd like to thank Dr. Vanitha for coming in. She's been a wealth of information on the show, talking about contact lens complications and dry eyes, and more importantly, infections. A lot of food for us to sit and look at and try to digest and also think about with regards to eye complications. Dr. Vanitha, it was a pleasure and an honor having you in the studios. Stay with us. We'll come back shortly with more for you. We'd like to thank Dr. Vanitha Ratnalingam, a consultant ophthalmologist and a corneal surgeon from Ramsay, Sime, Darby Healthcare, joining us right here on Medical Today. We'll be back just after a break. Stay with us. Hello Malaysia, and welcome back to the final segment of Medical Today. And right now what we're going to delve into is pneumonia, a problem we talk about a lot in Malaysia. And joining me in the studio is Dr. Chua Kiong Tiong, a consultant physician and respiratory physician from Ramsay Sime Darby Healthcare. He's here with us to walk us through what pneumonia is. So can I call you Dr. KT for short?
Okay, no problem.
Thank you very much. Well, being a respiratory specialist, I guess it's boom time for you with the haze coming back to KL, huh?
Well, unfortunately, it is. Every year, if we do have a significant haze issue, then a lot of my lung patients, they tend to come back to the clinic to see me.
Now, is it true that the haze actually affects people who haven't had lung problems start to develop lung problems?
Yes, they do. Right. I mean, when we inhale enough polluted air, right, haze is just one of the examples, right? So then the haze actually increase a lot of oxidative stress to the airway and the lung, and hence the immune system is weakened and the lung is more prone to problems. Infection is only one of them.
Right. I've got some questions that I'm going to ask offhand, which was given to me by a friend or people who stay in KL. But let's start with what pneumonia is. You know, some of us know it as pneumonia, but we'll go with pneumonia. What is pneumonia?
Well, pneumonia is a very, very difficult medical jargon. Actually, it is lung infection. It's as simple as that. Well, actually, what happened is that germs travel into the lung and started to cause infection in the air sac of the lung. So basically, inside the lung, really.
Right.
So when we do an X-ray, then we can see a white patch in the lung. So that's what it is. It's a lung infection.
So it can be ascertained. Pneumonia can be ascertained through an X-ray.
Yes, correct. It's essential to do an X-ray to diagnose a pneumonia properly.
Right. So when you say you've got a lung infection and pneumonia, is it one and the same, or is it two different things that we're talking about?
Well, in a very general term, it's about the same. I mean, medically, we are a bit more particular, but that's not important. I think for general knowledge, they are the same. Lung infection, pneumonia, you can put equal equation on it.
Okay, so how does this happen is because we breathe in what do you call it?
The
germs, and that's how it comes about.
Yes,
now,
correct.
what causes it to exacerbate within the lungs? You know, once you inhale the germs, you start developing an infection. The spreading of the infection, what exacerbates it? Waiting too long, not getting treatment early enough.
I mean that there are a few factors, for the pneumonia to progress in any individual person. I mean the first one is, as you mentioned, delay seeking medical help, which is not uncommon, unfortunately. So when we allow the germ to grow uncontrolled inside the lung, then really it not only can cause a worsening lung infection, it may also escape into the bloodstream, going around the body, causing all sorts of complication in a case of severe pneumonia. Right, but having said that, some people, they do come quite early, but despite that, they still do quite poorly. So what's the reason for that? It's actually because their body is weakened. It may be due to smoking, right? People who smoke, people who has got uncontrolled diabetes, people with a poor immune system, for example, HIV infection or certain medication to suppress the immune system. So when the immune system is not functioning properly, then the lung infection can really go uncontrolled.
Right. So now with the what do you call it? That we know what pneumonia is. Let's talk about its prevalence in Malaysia and within the region. How bad is it within? I hear in Southeast Asia, pneumonia is one of the more prevalent diseases.
Yes, correct. I mean, overall, I mean, in the usual day-to-day practice, right? So at any one time, there will be people with pneumonia hospitalized, right? So that's how common it is. Now, if you talk about proper statistic, right? So about 10% of the hospitalized people or patients will develop a pneumonia, either as a reason for admission or either as a complication of their pre-existing issues or illness, right? So and out of this, and pneumonia sometimes when we get really bad, it really can kill. Based on our Malaysia statistic in 2016. Pneumonia is a second leading cause of death in Malaysia, just behind heart attack. Right. So there's combined male and female. If we look at the female population or we look at the elderly population, pneumonia is the leading cause of death.
But why is that when we know that it's easily treatable?
Right. I mean,
you wouldn't go with that it's easily treatable?
Yeah, it may not be. I mean, sometimes practice medicine is a bit more complicated than that. So you see, when we see someone with pneumonia, right, then the doctor in charge will assess the patient and divide the pneumonia into 3 categories. Either it's mild, moderate, or severe. Usually, with the mild one, that is very easily treatable, as you mentioned. We just give some antibiotic as an outpatient. Right, and some symptomatic relief,
correct,
and
so
they'll get better.
If you deal with it early enough,
yes,
a course of antibiotics as an outpatient will sort this out.
Yes, correct. But sometimes they don't come fast enough, or as I mentioned, when the immune system is doing poorly, then the pneumonia can manifest a bit more severe. When it comes to the moderate group of pneumonia, then this patient will need to be hospitalized. They will need intravenous antibiotic drip, right, and they may need some oxygen. They will need some intravenous fluid to support the system as well. Now, in the severe pneumonia, then this patient, you should put them in ICU, right? And they are more likely to develop all sorts of complications. They may need dialysis support, if the pneumonia starts to affect the kidneys. The blood pressure might start to drop, and they will need medication to boost up the blood pressure. They may also get lung failure because the pneumonia is so bad. So the lung fail, then we have to do intubation. So using a ventilator to make sure the people breathe properly.
And intubation itself, the process in itself is quite a process.
Yes, correct, yes.
Yeah, so having said that, let's take a look at signs and symptoms of pneumonia. Now, what do I need to know about the signs and symptoms? When do alarm bells need to start ringing when it comes to pneumonia?
Right. Actually, the most important symptoms are 2, really. The first one is fever. The second one is dirty sputum. Right, medically we call purulent sputum, right? So when people start to get these 2, right, so then it's a good sign of some form of lung infection, and it's advisable for this person to seek medical help.
Right.
At the same time, they may also have breathing difficulty, they may have chest pain, they may have chills and rigors. All these are also symptoms of pneumonia. But fever and dirty sputum are the 2 important symptoms.
So when you say dirty sputum, how do I self-diagnose or self-ascertain what dirty sputum is?
Okay, sorry. So when the sputum can turn yellow, already is slightly what we call purulent or slightly dirty, then it may turn greenish and then it may turn brownish. Right, so that's the level of dirtiness in an ascending order.
Right, so brown being the worst.
Yes.
So it's your sputum starts to look like your furniture at home. It's time for you to go see a specialist.
Yes, well, definitely. I mean, by the time, need to see a doctor quickly.
Right. Now, the treatment options for pneumonia, what is out there as an arsenal to treat pneumonia in Malaysia?
The most important weapon to treat pneumonia is antibiotic, right? But here I would also like to stress that we have to be careful not to overuse antibiotic. Okay, but in the right hand with the right assessment, antibiotic is a mainstay of treatment for pneumonia. Right. At the same time, people may need some symptomatic relief like cough syrup, phlegm medication, and things like that.
Right. So when you talk about pneumonia, one thing that comes to mind is with the bad weather that we have, people start to develop a sort of a cough, a cough that doesn't go away for a long time. Not that it's a problem for some, but you can feel every time they laugh, you see people coughing. And that's a sign of there's something wrong with the chest. Is that true?
Yes, that's quite true, but I mean, that sounds like a bronchitis. Now, again, that's a common complaint I hear during the haze season, right? So that doesn't really mean it's necessary infection or pneumonia. But you see, again, at times, like inhaling too much of polluted air, the bronchus or the airway can go into inflammation, and hence that makes people cough, right? But that is actually because of the irritation of the air pollution rather than an infection.
Right.
So in this kind of case, antibiotic may not work. So these are people with bronchitis, they need some other form of treatment.
Saying if you've developed pneumonia and you've taken a course of antibiotics or you've been treated for it, you're better now. They say that once you get it, you're susceptible to getting it again.
Well, I mean, that's not exactly true. I've seen so many patients. They come to see me with one episode of pneumonia, and subsequently I don't see them again.
Right.
So, but what is important is that after I treat someone with pneumonia, I must look at them. Is there any other preventable issue, or is there any risk factors I can help them to change or modify to reduce their risk of having another pneumonia in the future? For example, if people who smoke, I'll ask them to quit smoking. People with poorly controlled diabetes, I'll strongly advise them control their diabetes well. Once they've done that, then the chance of getting pneumonia will reduce.
These all fall under lifestyle changes.
Yes.
Do people take these things seriously, making those lifestyle changes?
I wish Malaysian overall can do it better. Right. Smoking cessation is something we take to our heart as a lung specialist. Right. We strongly advise anyone who smokes to quit smoking. Right. It's never too late to quit smoking. Right. So, and there's numerous and countless benefit of stopping smoking at any time, any point of your life. But having said that, it's not easy. I mean, personally, I've seen more people who have failed to quit rather than those who come back and say, "Hey, doctors, thank you very much. I've quit smoking." I think those are still smaller in number.
Right. So, if you say pneumonia is as bad as what it is, what about people with underlying problems? People who have asthma or who have weak lungs, generally have weak lungs. What is your advice to them about pneumonia?
Yep. I think, I mean, if the person has got pre-existing lung disease, then definitely they are at increased risk of pneumonia. Then the thing is, treat the underlying problem well. I mean, as you mentioned asthma. Asthma nowadays is so treatable, right, with the current treatment. And also other form of lung diseases. So
treatable or manageable?
Both treatable and manageable. I mean, when we do it well, right? About statistically, 80% of asthma people can live on like a normal person.
Right.
So you can call it treatable, right? So, so the same apply to some other form of chronic lung disease. If we can treat it well, then we can minimize the risk of pneumonia. Right, so another thing we can advise, I usually advise my patient with chronic lung disease is that take vaccines. Right, nowadays there are two important vaccines for pneumonia. One of them is an influenza vaccine. Basically, it's a H1N1, H5N1 jab. right?
Yeah,
So
that's the yearly vaccine, isn't it?
yes, correct. Yes, it's once a year. The other one is what we call a pneumococcal vaccine, right? So there are two of them in the market. So pneumococcal is another germ that likes to attack the lung and cause pneumonia. So again, once we take it, then we actually reduce the chance of these people getting pneumonia.
But it's interesting you should talk about it because most of us who work in broadcast are always advised by our doctors to have those vaccines done because we meet people on a daily basis, interviewing people all the time.
Yes.
Now, before we close, we've got about 30 seconds left. What's your advice to Malaysia with regards to pneumonia?
Right. Okay.
As a respiratory specialist, yeah.
Sure. Right. Now, pneumonia is a serious disease, okay? But at the same time, it's also a treatable disease as long as people recognize it and come to get treatment early. At the same time, pneumonia is also a preventable disease, right? So if we can manage our lifestyle modification well, then we actually can help to reduce the incidence or the cases of pneumonia as well as reduces the people who die from pneumonia.
Well, we'd like to thank Dr. Chua Kiong Tiong, a consultant physician and respiratory physician from Ramsay Sime Darby Healthcare, joining us to talk about pneumonia, giving us so much information as to what we can do to treat ourselves and to better understand the disease. Now, if you do have any questions for us, please do send it to us. We've got a whole range of specialists who'll be able to send you an answer. Send your question to ask@medicaltoday.my. That's ask@medicaltoday.my, and we'll send you the answer. And not only that, we'll send you an answer furnished with a bottle of vitamins courtesy of Pharmaniaga. On that note, on behalf of the Medical Today team, I'm Gerard Ratnam signing off. You have a great weekend and a fantastic week ahead. Thank you very much, Doctor. It was a pleasure having you on the show.